Hello everyone, welcome to today's Tech Talk. We're here to bring you the latest in digital transformation for health and care sectors. My name is Janine Bennett. I'm the Assistant Secretary and Engagement Lead for the Department's Digital Transformation Program. And today I'll be your moderator for the webinar. It's really great to see everybody. I can see people are still arriving, but I'll start by acknowledging the lands of the Ngunnawal and the Ngambri people. I'm joining you today from Canberra, and I'd like to acknowledge those traditional custodians of this land and pay my respects to elders past, present and emerging. Also like to extend that respect to any Aboriginal and Torres Strait Islander people joining us today. It's great to have you with us as always. A few quick housekeeping notes before we get started. If you have connection issues during today's session, there's dial-in details on screen. You can also access those in your meeting invite. As usual, today's webinar will be recorded. We'll upload that recording to our website so you can watch it again or share it with anyone who wasn't able to join us today. You can also watch any of our previous webinars on that site. If you've got a spare 26 hours or so, you can go back and watch from the beginning. The links for the QR codes we show today during our sessions have already been posted in the meeting chat. So feel free to copy any or all of those, especially if you're not a fan of QR codes and would rather just have a straight link. We'll also make sure that these links are added to the email that comes out after the meeting, and you can expect to have that by the end of the week. Just be aware that we have our chat function turned off, but we do encourage you to ask any questions using the Q&A panel. And speaking of Q&A, our last segment today, as always, will be set aside for questions. You'll find the Q&A tab at the top of your Teams window. Ask your questions using the Q&A tab at any time throughout today's webinar, and we'll queue them up for the panel. Remember also to vote up anybody else's questions that catch your interest. You can use the arrow below the question to do that. We'll try and get to the most popular questions first. As always, if we get more questions than we have time to answer, we'll take them on notice. For any highly specific or detailed questions that are related to your particular individual circumstances, we do encourage you to include your name with your question. The reason being it allows our team to contact you and work with you to get an answer for your specific circumstance. If you prefer though, you can always email us your question directly, and on screen right now you'll see that there is the address that you can use for that. It's Digital Services Sector Engagement at health.gov.au. If we don't get to your question in session, please know we're not ignoring you. We will either come back to you individually. For really popular questions, we do try and bring them back to future events. We also use those questions to plan our future agenda items for upcoming tech talks. Where we need to, we do reach out to our policy colleagues for questions, but just keep in mind that our focus here is on technology and delivery work. So that's the main area of focus that we're looking to talk about in the tech talks. Just a very quick note also for any media representatives who are joining us today. First of all, welcome. We really appreciate your continued interest in our transformation work. If you do have any media related questions, please direct those to our media and events team. You can do that by emailing news@health.gov.au. They're going to be in a good position to help you with any of those media related questions. And a quick disclaimer, here at Tech Talk, we do make every effort to make sure the information we provide to you is accurate, relevant and informative. But be aware, it's never our intention to provide specific advice for individual circumstances. We're really careful also to not comment on government commitments outside of our digital transformation work that gets shared elsewhere. The information we include in our Tech Talks is presented to share common experiences and concerns, so collectively we can identify and tackle common challenges, but it's up to each of us as individuals and individual organisations to exercise our own skill and judgment about the information that suits our individual needs and what applies to the situation that you're in. So just an important thing to keep in mind as we proceed. Okay, so on to today's agenda. As always, we have Faith Lavaris with us, who will be starting us off with the digital transformation update. We're then joined by Michelle Pham from the Aged Care Provider Systems branch, who's going to talk about the recent API release for business to government. From there, we welcome Kai Trainer from the Home Support Operations branch, who'll be taking us through some updates from the Commonwealth Home Support Program. And a little something different today, we're welcoming John Jamieson, who is the Assistant Secretary in the Therapeutic Goods Administration. John is going to give us some insights into the regulation of medical devices and therapeutic goods. Finally, we'll have another learning bite for you that will be delivered by our Director of Sector Engagement, Emily Simlat, and then we'll finalise the day with our usual Q&A. Okay, so on that note, I'll hand you over to Faith Lavaris. Faye is our Chief Digital Information Officer here at the Department of Health, Disability and Ageing. Faye is responsible for driving the department's digital agenda, including our digital strategy, our 10-year digital investment plan, as well as being the department's AI Accountable Officer. Faye, welcome, and over to you.
Thanks, Janine, and hello everyone. Thank you for joining us again today. So without further ado, let's start by showing you the roadmap, as we always do. And of course, the roadmap comes with my usual disclaimer, which we make a point of sharing this roadmap early and often. But when changes occur, we will aim to call them out and let you know. But it should not be considered an official commitment from government to deliver specific initiatives or scope or a commitment of timeline. This is just our internal transformation roadmap that we share early with you so that we can be transparent. Final decisions are subject to cabinet and government decision-making processes. And we had another successful release in June, delivering changes across our aged care ecosystem, which includes our government provider management system, our business to government gateway, and the My Aged Care system as well. For GPMS, the release focused on reporting and form upgrades, improving the display of various provider conformance outcomes, and adding new functions to enhance the user experience in the Manage Your Organisation tile and other system updates. And for My Aged Care, we streamlined the assessment and reassessment workflows and enhanced the display of decision information. So support at home notifications, data analytics, and the CHSP processes were enhanced. And I'll leave the B2G news for now, as we do have Michelle later on in the agenda, and she'll be covering that shortly. So over at the Aged Care Quality Safety Commission, as you can see, we now include them in our roadmap so that you've got one view of the government changes. They've also been really very busy with releases, and since we last met, they've improved the public data usability and end user engagement for their provider registration, and they've completed all scoped regulatory readiness activities under the Aged Care Act for 2024. So now to look at our confirmed releases for the second half of the year. And yes, I can't believe we're already talking about the second half of the year. It's already half gone, folks. And what we're looking in our October GPMS release will include the capability upgrades to enable the multi-purpose services providers to do 24/7 nursing reporting in their system and support the government's 2 new capital subsidy payments for newly built or significantly expanded aged care homes. For My Aged Care, a little bit later in the year, we're introducing a new client journey tracker. We're adding additional screen tools for assessments, and we're fully integrating provider specialisation verification workflows for providers and assessors. And an enhanced provider specialisation verification application and assessment process. We'll also be enabling people to search by provider specialisation in the Find a Provider tool, so hopefully that makes it easier for them to find the services they're looking for. And there will be an enhanced specialisation search capability in the Assess portal as well. Our colleagues over at Services Australia are also keeping busy with releases to personal care changes, capital subsidy payments, and digital hardship applications. And meanwhile, the Commission will also be releasing enhancements to smart forms and a bulk upload solution. I know that's one that people have been asking for. Internal case management system updates and an API capability to automate provider change declarations and seamless integration with their back-end system. That's all for now, folks. There's quite a lot there, and we'll make sure to keep you up to date with more planned releases as soon as they're confirmed. Now, last time we met, we launched a poll, and I'd like to play back the results for that in our last Tech Talk. As a reminder, we asked you 5 questions to find out what you, our audience, wanted most from our Tech Talk webinars. Around 40% of the audience that responded for us, and giving us a great representation of your sentiment. The value rating came in at about 4 out of 5, so not too bad. And topic relevance came in slightly under at 3.9%, 3.9 stars. So when we look at those ratings in tandem with your free text responses, which you'll see in the next slide, we're able to be quite specific about the topics you'd like to see included in our future sessions. So our anchor presentations on the digital transformation roadmap and changes and updates to our major systems and programs are still high on the list, so thank you. Our new kid on the block, the AI Learning Byte that we've introduced, has been cited as useful and informative, and we'll definitely continue with some of these. It is clear you're hungry for information, and that our sessions provide an easy avenue to get what is relevant to you without having to trawl through masses of documentation. So we got some suggestions for improvements, such as a time-stamped agenda released before the event so you can target attendance to your specific areas of interest, detailed case studies on API and AI usage, and broadening our roadmap to look at linked areas of the care economy like disability, health, and allied health. We also heard that you want both more entry-level information for those that are just starting out and more detailed technical information. So we're thinking about how we might balance those different requests to meet everyone's needs. And one of the resounding pieces of feedback we received was that you wanted more information on the Commonwealth Home Support Program, and I'm happy to say that we've responded with that one really quickly, and we've included a CHSP presentation for you guys today. So big thank you to everyone who responded and contributed. It really does provide us insight into what you're looking for, and we'll incrementally look to incorporate this feedback in future sessions. And if you missed the poll or you just wanted to give us some input, you can do that at any time by emailing us, and the email link was posted in the chat. Great. So moving on to some of the resources that we have for you today. This is useful information for various parts of the sector. First up, in preparation for the aged care rules commencing on the 1st of October, the Support at Home team is working to produce materials to give a clear explanation about what the change is and what it means. And one of the new resources which has been developed is a short video that outlines the changes coming into effect, along with key steps that you can start taking now. The video forms part of a broader suite of materials that will be updated as more guidance becomes available, and we will continue to bring that to your attention when we have the details. Still on Support at Home, with some information from Services Australia, which many of you may already be aware of, but after the 26th of June 2026, requirements for late invoice claiming has changed, so providers no longer need to provide evidence. When providers submit a late invoice to be claimed, they will need to select a reason for the delay, and if using the Aged Care Provider Portal, they will not need to or be able to attach supporting evidence. This change applies to late invoices only. All other invoices claimed must follow existing evidence requirements where applicable. If your software is configured to attach supporting evidence for late invoices claimed, providers can still provide it as an optional when submitting through the business to government channel, and Services Australia will accept the claim. They will suggest that you update your system as soon as possible to reflect that late claim evidence is no longer mandatory. Ensure users are not prompted or required to upload evidence for claims. That's not necessary. And be aware that further changes may be required to late claiming in the coming months. Services Australia has more information on their website and in their e-kit. The QR code's on the screen and the link was posted in the chat earlier. Moving on to our last piece, which is a quick kind of public service announcement. Oz Alert is Australia's new national emergency warning system developed by the National Emergency Management Agency, where alerts will be sent directly to mobile devices to keep people informed and safe during disasters. To support this, stakeholder kits are now available, and these are ready-to-use communication packs to help you explain the Oz Alert is, what it is, and how it works. The kits are tailored to key groups, including older Australians and people with disability, cold communities, and First Nation audiences. Thus, we thought it would be very relevant to share with you here today. And each kit includes simple resources, including fact sheets, posters, social media content, and explainer videos. These materials are designed to be accessible and inclusive with easy read versions and content available in multiple language and Auslan. So a national test will occur on the 27th of July before it is ready to use in October this year. So for more information, of course, please go to the QR code on the screen, and we'll also share any relevant links in a pinned post on our post-event materials. So that's all I have for you today as far as resources are concerned. I will now welcome Michelle for an update on the business to government space. So over to you, Michelle.
Thank you, Faye. Hi, everyone. My name is Michelle Pham, and I'm from the Digital Transformation and Delivery Division. Today's session will provide an update on the successful release of the client APIs on Monday, the 29th of June. Next slide. B2G responds to Recommendation 109 from the Royal Commission into Aged Care Quality and Safety. The aim is to make it easier for aged care providers to share information with government through secure system-to-system API connections. In practice, this means the APIs are designed to reduce manual data entry, duplication and delays, support faster access to essential client information. By improving how provider systems connect, B2G helps staff spend less time on administration and more time supporting high quality care. Next slide, please. So the client APIs were successfully released on 29th of June and are now available in production. The client management, referral management, support plan and assessment APIs allow access to key client information, allowing deeper assessment, care planning and service delivery preparation. In-depth information, including the API specifications, is now available on the B2G developer portal. We would like to remind you that assessors were out of scope for the initial release of the client APIs, with the discovery piece underway to understand the use case for assessors. By connecting systems more smoothly, these read-only APIs enable faster client onboarding, allowing access to essential client information to begin service planning. Less manual data entry, reducing time spent copying information from My Aged Care into your system. More accurate and consistent information with fewer errors and duplicated details across platforms. Better support for care planning with the right information available to you at the right time. So what this means for providers, this means reduced time spent on administration with faster access and more accurate client information, ultimately meaning more time being able to be spent on direct care to older Australians. To reduce friction around the onboarding of software vendors and their products, the B2G platform provides improved data flows, reducing reliance on manual data exchange and streamlined onboarding journeys. Consistency with other B2G APIs, aligning patterns, structures and documentation, and clear integration guidance with developer resources published on the B2G developer portal. Overall, supporting smoother provider workflows and reducing the complexity around integration. So the B2G team will be available to support software vendors throughout the process of conformance and testing for the client APIs. If you have any questions, please email us, visit our portal and our website for more information. Thank you.
Thanks, Michelle. Okay, so now we're moving on to our support at home agenda item. This is one that you've asked for. We welcome Kai Trainer. As I said earlier, we are responding to your feedback to make sure we put more information on CHSP on the agenda. Before I hand over to Kai, I'd like to say that we appreciate providers may have questions about the future of CHSP, including any extension of the current CHSP funding agreements or information about the program. And sorry, I think I misspoke there about you wanted more information on the Commonwealth Home Support Program. Yeah. As these matters are currently with government for consideration and no decisions have yet been advised or announced by government, I'm just being very transparent and forthright about it, that as a department, we are not able to provide any updates on these matters at present. So welcome, Kai. I'm sure the audience will appreciate the time you're making today, and let us know what we can tell them. So over to you.
Thank you very much, Faye. So my name's Kai Trainer. I'm a Director in Home Support Operations Branch, and I look after managing CHSP compliance and selections, a component of which is CHSP reporting. So what I can talk to you today about is some things happening in the CHSP space related to our next DEX release, so changes in data exchange reporting for CHSP, and also just to let you know about some recent updates we've made to the CHSP manual. So I'll start with DEX. As you're likely aware, the department released stage 1 changes from 1 July 2025 to align CHSP services with the service list in the Aged Care Act. Our stage 2 changes, which capture the My Aged Care ID of clients providers are delivering services to under the CHSP, went live in January. They were implemented as an optional field to give people time to configure systems for an interim period, and those reporting fields are now mandatory. That got switched on at the end of June. And so our next set of changes that are coming up, our stage 3 changes, are due to go live in a release on the 11th of August. So what's changing? Our CHSP stage 3 changes will introduce some new data fields in the session record for various CHSP service types, and that will enable the department to collect more information about specific elements that CHSP funded organisations are supplying as part of their CHSP service delivery. These additional fields relate to performance, quality, and operational implementation of how providers deliver services. Why are we making these changes? These changes are largely based on feedback from the sector and peak organisations, which is that the elements we're introducing are not, and the associated costs to providers in providing these elements are not appropriately considered in the CHSP funding model. And so the level of granularity of the reporting elements being implemented will support the department to better understand the extent of the costs across CHSP service provision, and it'll assist providing an evidence base for program evaluation and future development and design options. We've published a range of information to support the change. So we put some documentation up on the department's website, which we advertised in the Sector Your Aged Care update on the 3rd of March, and that included a CHSP guide to DEX data stage 3 changes, links to the staging environment technical specifications for system-to-system transfer and bulk upload, and a DEX stage 2 and 3 implementation update of where we were tracking at that time. In addition, today we have published a CHSP guide from 1 July 2026 onwards, which will support providers to report in DEX moving forward. It consolidates all the information on our recent changes, inclusive of stage 1 to 3, and it provides some really great detailed case study examples and scenarios across all service types to support providers with their data entry. So hopefully that will be a good resource for providers moving forward. Now, we are aware that our stage 3 release is happening on the 11th of August, and that's going to have an associated impact on July reporting. Please be assured we've worked very hard with our delivery partners to implement the release as early as possible in the new financial year, but we do appreciate that there is going to be some impact on reporting for providers. To try and support this, we've issued to providers via their funding arrangement managers a blanket extension of time to upload July data. So July data is usually due on the 14th of August, not ideal timing. So we've given a blanket extension of time until the 30th of August. However, if providers do need additional time beyond the 30th of August due to system configuration constraints, they're very welcome to request an extension of time with clearly specifying when they need an extension to by emailing their funding arrangement manager at the Community Grants Hub. In addition, if providers have related technical challenges prior to the August release, we'd be really grateful if you could get those triaged through to the department through your funding arrangement manager with as much detail as possible. And that will allow my team to then work with our technical colleagues in the DEX space to troubleshoot and provide any additional guidance and support that we can on those matters. Following the DEX release on the 11th of August, we would ask providers and vendors to engage with the DEX help desk through their usual web form to request assistance. And I think the last thing I need to cover off there is in line with previous releases for DEX, the technical specifications for the production environment will be loaded up on the DEX website following the release, so shortly thereafter, the 11th of August. And that is all my my talking points on DEX. I will now move on to just let you know that we've also been doing some work to update our CHSP manual, and that went live yesterday. And we also published a notification to the sector in the Your Aged Care update yesterday. So the changes we've put in are largely to provide additional content and links to information related to the implementation of the Act, and also in relation to the Support at Home program and interactions with the CHSP. We've worked to provide more clarity in particular sections based on queries from specific providers and the sector in general, remove content that is no longer relevant, and try and make it as helpful as possible. So a summary of changes document has also been published along with the updated manual and is available on the website to help providers see what's changed. As with any changes to the manual, if you have any queries or concerns or anything is unclear, please raise those with your funding arrangement manager and they can send them through to the department for a review for our next update. And that is my update on CHSP. Thank you.
Thank you, Kai. We really appreciate that, and we'll all be watching next steps for CHSP, so I'm sure you'll become a regular on our Tech Talk. Now, our last speaker for today is a little bit of a different one than our usual aged care focused topics, but we'll speak on a topic that's very relevant to the wider health and care economy. And the regulation of therapeutic goods is a function which underpins the healthcare sector. The organisation evaluates, assesses, monitors the therapeutic goods, and this list includes medicines and what is of interest to us today, medical devices. I will let John elaborate on this fascinating subject. Welcome, John, to Tech Talk, and it's great to have you here with us today.
Thanks, Faye. And it is great to be here, and good afternoon to everyone. So I'll talk about the regulation of medical device software and AI. I'll talk in a little bit more detail about digital scribes, but where I start, I might talk a little about who the TGA is. So if I can have the next slide, please. We regulate therapeutic goods. Well, what are they? Well, loosely speaking, that's the medicines, the biologicals, and medical devices. We regulate the supply of those products. So that includes manufacturing, advertising, import and export. And we're focused on safety, quality, and performance. So those are the things that we do. The next slide, please. There's a bunch of things we don't do, though. We don't regulate consumer products, things that are not for therapeutic use. So specifically in the software area, we don't, for instance, regulate wellbeing software. We don't regulate, if your step counting app on your phone, for instance. So we also don't regulate privacy unless it impacts the safety or performance of a medical device. And we also do not regulate clinical practice. That's outside our remit. So, when we're talking about software, medical device software is really just one subset of all of the health software that's out there. So I probably need to explain a little bit more, next slide please, about what that looks like. So software is a medical device when it's intended for diagnosis, prevention, monitoring, prognosis, and we've got a very long list of things that medical devices do. If software does any of those things, it's a medical device. So loosely speaking, diagnosis or treatment, but there is a much more complicated list, as you can see there. It's also an accessory to another medical device is also a medical device. So software that's an accessory to another product that is a medical device is also captured. The intended purpose for the product is critical to that definition. So if the device is designed or intended explicitly to do any of those things, then it becomes under our framework. Next slide, please. So there's some challenges with software that are a little bit unique. These would be things, if you're involved with software at all, you'd be fairly familiar with, but just to run through them quickly. Software is easy to reproduce relatively compared to some other products, but it's also, its supply via digital marketplaces looks quite different to supply through bricks and mortar channels. Software doesn't respect national borders, so particularly when products are cloud-based, and that makes, as a regulator, that makes life a little bit harder sometimes because we don't regulate activities outside Australia directly. Software is also multifunctional, so it's part of a broader, more complex system, and then working out what the intended purpose is and whether it's regulated can also be very tricky. Another issue around software for us is that many developers are new to our regulatory framework. They may not even be aware that we exist so much. And so that's also part of the reason that we're doing a lot of education in our sector. One of the reasons we're here today, for instance. Software can change quickly. So a thing that is not regulated by the TGA today might be regulated tomorrow because of an update that's happened to it overnight. So it starts to get fairly complicated. Cybersecurity for any devices, particularly that are connected, but also more broadly speaking for the safety of data and so on, is also an issue for medical devices. And the compatibility with third-party products, that also arises. If you, particularly for a lot of medical devices, if your app is controlling your blood glucose monitoring device, and then your Bluetooth connects to your car and it stops working, then that becomes an issue, for instance. So there are a bunch of issues that relate to software that for medical devices start to become more important. Thanks very much. Next slide, please. You add in artificial intelligence and it starts to get very even more complicated. Large language models are typically historically have not been validated for a medical purpose. The AI is not always immediately visible in the design. Sometimes products that claim to have AI in them may not, and products that don't disclose the use of AI are using AI. So it starts to get difficult there. Privacy and consent. It's difficult to have a conversation about AI without privacy and consent arising, especially in a medical context. So that's always an issue for us. And the rapid development and diversity of AI systems. I mean, we all are seeing that across our sectors every day. We know that, for instance, when we get to digital scribes, there are some really large contracts being negotiated as we speak or already been deployed. So it is rapidly taking over or being used in all sectors. Clinical practitioners are always aware of the extent that they're accepting the risk that comes with the use of AI. Not to ignore the benefits that can come from those products, but sometimes the risk might not be immediately apparent to the user. I think that one of the big issues, it comes back to that first point around whether or not the product's been validated for a medical purpose, but sometimes the data that is used to train the model or the AI may not be from the same population that the product is meant to be used on. So that really brings into question whether or not what the AI is telling you is valid or not. And indeed, the AI model may not be always based on good clinical or scientific evidence. So that's some of the stuff that makes our life interesting. The next slide, please. But there's also a lot of, I guess, the legal framework around AI and software is also not necessarily the TGA. So the Privacy Act applies regardless, and we don't regulate privacy. The Cybersecurity Act adds requirements that are governed by the Australian Cybersecurity Centre, for instance. And as I mentioned, we don't regulate health practitioners. So the National Registration and Accreditation Scheme, administered by APRA, but also any other health practitioner schemes or health worker schemes that exist outside, they exist outside of the TGA remit. And indeed, the Australian consumer law. So we don't deal with things like procurement and warranties and consumer rights and so on. Thank you. Next slide. I want to talk, as I promised, we talk a bit about digital scribes. But what is a digital scribe? So I want to talk a little bit about when a digital scribe is not a medical device, and then go on to talk about when it is a medical device. And this might help you understand our framework a little bit more as well. So if the digital scribe is in the background recording, or loosely speaking, listening to a conversation between a patient and a practitioner, then that doesn't necessarily make it a medical device. So if the scribe is documenting that conversation, transcribing and organising that information based on things that are explicitly stated during that consultation, or indeed if it might be a dictation setting where the health practitioner is dictating to the scribe, and where the practitioner or user can apply basic editorial changes, check that the transcription is correct, modify the formatting. None of that makes the product a medical device. However, there are things that can easily new features that can be added to that scribe that would turn it into a medical device, and manufacturers have to continuously monitor and be aware of that. If I can have the next slide, please. This then talks about, well, if we go beyond that, what are those other features that would actually turn it into a medical device? So anything that's adding clinical insights and recommendations, so new clinical content that was not explicitly stated by the practitioner or by the patient, and that could influence clinical decision making. So for suggesting a diagnosis or anything that sort of hints at a treatment or prevention option, prediction, prognosis, all of those things turn it into a medical device. So if it's talking about identifying risks, recommending next steps or management options, anything that informs that clinical decision making, it's a medical device. These are some of the reasons. Thanks. These are some of the reasons we recently did a review of digital scribes. There's a lot of products out there. It's all of those complex factors that I've talked about previously came up in our review. But one of the reasons we were looking at these products is because they had been deployed rapidly, that their functionality was expanding beyond just basic transcription. We had a lot of user concerns, and we didn't have a lot of visibility. So we were also aware that it was really rapidly influencing clinical care in all sectors in health. The next slide, please. So what did we find? So our initial findings, our review is ongoing, and it's also, but I guess our initial findings are that there was a lot of use of AI chat-based features to influence decisions. So that's the sort of thing that really does start to raise the question about it becoming regulated as a medical device. So there was medical device functionality in a lot of the products we saw. Diagnostic recommendations or suggestions going beyond, basic transcription errors to actually suggesting things, and maybe even suggesting treatment plans, recommending the sorts of tests or investigations that the practitioner might initiate. There was a rapid emergence of new large language model-based features, but also a lack of transparency and safety controls, generally speaking, where it wasn't apparent necessarily around how the scribe was coming to recommendations or decisions, and the sort of safeguards that we would think should be in there weren't necessarily there. So that's our findings initially. The next slide, please. We've got in our environment, there's a lot of other stakeholders that we're working with. So we've got a lot of people that you'd be familiar with. I've mentioned already that people like the AHPRA. We work closely with the Office of the Australian Information Commissioner, people like the ACCC and the Australian Commission on Safety and Health, Safety and Quality in Healthcare, but also all the state and territory governments, in particular the health departments in those areas. So we've got a lot of linkages when it comes to AI governance. The next slide, please. So I've given you a bit of an overview about our work on AI scribes. We're moving now very much into a compliance phase now with that work. So we're in conversations with a lot of the scribe developers that are out there about achieving compliance with our regulatory requirements. But if you or any of the people that you know need to find out more about how we regulate software-based medical devices, that's what this page is for. I understand these links are also in the chat, so thank you for putting those there. We would welcome people getting in touch with us. We try not to be too scary, but if you want to find out more about how we regulate or whether your product should be regulated or any of those questions, please use these channels. Thank you. That's the next slide, please. Thank you. That's me. I'll hand over to you, Faye.
Thanks, John, and really appreciate it. I think it was interesting. It's quite a complex, area, and we appreciate you coming along and sharing some of that insight with us. Now I'd like to hand it over to Emily Simlat, who is here again to present another little learning bite, this time on the difference between an algorithm and an AI. So over to you, Em.
Thanks, Faye. Hi, everyone. It's great to be back with you all today on this Wednesday. As part of this AI Learning Bite series, we've previously shared some practical insights on topics such as digital safety and emerging AI technologies, with a focus on what they might mean for your organisations in practice. But today we're focusing on the difference between AI and algorithms and why that distinction really matters. This is about helping you feel confident explaining how systems work and what that means in real-world terms. It's particularly relevant as more tools are introduced and described as AI, and there's an increasing interest in how these systems operate. The simplest way to explain the difference is that algorithms are instructions. So an algorithm follows a defined set of steps, which means that the same input will always produce the same outcome in a consistent and predictable way, which makes them more traceable. AI, on the other hand, is a system that learns from data. It can analyze data, recognize patterns, and generate outputs that may change or improve over time as it's introduced to more information. It's important to note that AI is built using algorithms, but once learning and adaptation are introduced, the systems behave differently. This distinction of instructions versus learning is really helpful because it gives you a simple way to explain these concepts to different audiences, especially those of a non-technical background. Understanding the difference matters because it directly affects how a predictable system is and how much oversight may be required. With algorithms, like we said, the outcomes are consistent, repeated, and easier to trace, which means that they're generally simpler to predict, explain, and validate. On the other hand, with AI, outputs may vary depending on the data and patterns identified, which introduces a little bit more complexity, more unique outcomes, and requires stronger oversight and understanding. By understanding whether a system is rules-based or an algorithm or learning-based, AI, organizations can better assess potential risks, explain outcomes clearly, and ensure appropriate safeguards are in place throughout the life cycle of the technology use. The Australian government also emphasises that AI should be used safely, transparently, and with human accountability, which reinforces the importance of understanding how these systems behave. In practice, this can be understood by focusing on whether we are applying fixed rules or identifying patterns in data. So algorithms in the service context could include generating standard reports or triggering alerts based on set thresholds because they follow predefined logic and produce consistent outputs each time. In contrast, tools that summarize notes, identify trends across large data sets, or generate insights from multiple sources are more likely to involve AI because they analyze the patterns rather than simply apply the rules. For example, a rostering system that follows fixed rules are algorithm driven, while systems that optimize schedules based on work patterns are more likely to incorporate AI capabilities. It's also important to recognize that many tools are hybrid, meaning they include both rules-based and AI components. So the distinction's not always clear-cut. But the key takeaway is that what matters most is how the systems behave rather than what it's labeled. So once again, understanding the difference between the two helps organizations make more informed decisions about how technology is used and managed. And this also supports clearer communication with staff and stakeholders, particularly when explaining how systems work and where human judgment sits. That's all for today's Learning Byte. The source, these slides have got a little website down the bottom, which is ai.gov.au. I recommend bookmarking that one as well. It's got a lot of great information on that as well, and particularly in relation to AI versus algorithms. That's it from me. I'll hand back to Janine because I think it's time for Q&A.
Thank you very much, Emily. Always good to get a little learning bite. And I think we see a lot of confusion between AI and algorithms, and it's perpetuated across the board in the media and elsewhere. So just getting some clarity around that is, I think, really important to understanding the tools we're using in the different circumstances. Okay, so let's get Faye and our panelists back on stage. So pleased to welcome back Faye, Michelle, Kai, and John. Thank you, guys. Great to have you with us. We might just drop the Q&A slide as well, so we can see the faces of our panel while we're talking to them. We've got a healthy number of questions today, so we're going to try and get through as many of those as we can. Before we start, I do just want to say that we've taken a number of questions on notice in relation to QFR and a couple in regard to Services Australia. We don't have those subject matter experts in the room today, so we will take your questions on notice. We'll also look at feeding those questions into future agenda items. I can see there's quite a bit of interest in the QFR, the alignment between QFR and ACFR, and the new audit stuff that's coming up in this current financial year. So we'll try and get something on a future agenda for you there. Starting there with a question from Nicole. Faye, I might just direct this one to you. So there's a bit of a comment here from Nicole around that a growing number of providers, it seems in regional areas, that are transitioning out of aged care. Nicole's concerned this is a trend that's going against what the department was hoping to achieve, which was more choice for clients, moving towards a number-based system, not a client-centred system. Do you? It's a curly question, but I feel like we answer curly questions here at Tech Talk as best we can. So
I was going to say we're always happy to receive them, and we appreciate your comment. And although it's not something that I can comment on today in our Tech Talk, We are happy to provide that feedback to our policy colleagues. And I do agree with you that the changes with the Aged Care Act was about putting and allowing the elderly to put choice and control back into their hands. And so we'll just pass that information on and come back with an answer next time for you.
Thanks, Faye. Appreciate that. And thanks for the question and the comment, Nicole. We have also a question from Sharon. This one is around CHSP, so I think it's a good one for you, Kai. Providers deliver multiple CHSP service types, including domestic assistance, personal care, nursing, allied health, home maintenance, home modifications, group social support, and community transport. So lots and lots of different services delivered under CHSP. The question is, given that client contributions are often capped across multiple services rather than calculated separately for each service, pensioners and other financially disadvantaged clients may receive concessional fees. Some clients receive a combination of services under a single fee arrangement. How does the department expect providers to accurately report client fees and contributions at the individual service level for reporting and compliance purposes? Kai, over to you.
Yeah, no, that's a great question. So in great news, our DEX guide that we published today actually covers, we're aware that there's different contribution ranges under different providers' fee policies. So the guide that we've published today does step out a number of examples of how you would capture your client contribution within the session record, and that includes clients with varying fees for whatever reasons, and also gives examples of how where you've got a group session that you've got multiple clients attached to, all who may have different contributions or not have a contribution at all. So we've kind of tried to step that out as much as possible in our case study examples. I will, however, have to admit I'll need to further consider the matter of providers who might cap client contributions across multiple services. So that's not a question I've been asked before. So I will endeavour to take that back to the Brains Trust, and we will knock that around in the interests of providing further advice in the future.
Awesome. Thanks, Kai. And thanks, Sharon, for the question. It's always good to prompt thinking and make sure we're seeing these issues from right across the viewpoints of the sector. Just one thing for my team as well, let's make sure we get that link to the newly published DEX guide into the post-event email as well. Okay, we've got a couple of questions from Megan, and these ones I think will go to Michelle. So the first one is, for the APIs, are these FHIR-based, F-H-I-R-based? So Michelle, perhaps you can explain FHIR-based for those in our audience that want it to be a little bit less technical. If we can give a very quick summary of what that means, and then if you can answer Megan's question, that'd be great.
Yeah, so yes, the question is, and the short answer is yes, the B2G API strategy is FHIR-based, so FHIR aligned at the external API layer, but the underlying source systems and integrations aren't not uniformly FHIR native. The B2G acts as the interoperability layer that exposes FHIR compliant resources while integrating with the max of B2G backend technologies. So FHIR, it's like a standard, I guess from data perspective. Can't think of the top of my head what it stands for, but
I've put you on the spot there.
Healthcare interoperability resources, sorry.
I reckon Faye might remember what it stands for.
Oh, don't do that to me. I'm not even going to explain it. What I will say, back to Michelle's point, is FHIR ends up being what I call like a data language, an information standard. And what we're trying to do is encourage everyone in the healthcare and support economy to leverage the same standard to make it easier for us to interoperate across the care ecosystem. So other areas of the department have been doing some work with the CSIRO, and there's a program of work called Sparked that if you haven't heard about, you can definitely get online and have a look. Right from the very beginning, when we started developing our business to government gateway, we said that we would be FHIR aligned. Now, noting that the aged care domain is not the primary area that the Spark team were working on, we have endeavoured to think ahead and augment into the FHIR standards, and we're hoping that they will pick that up and make that the whole, the standard for Australia. But yes, get online onto the developer.health.gov.au portal, and you'll see all of the information there around what our data standards are. So
Great.
thanks.
Thank you. And Megan had a follow-up question. She said, is anyone using the newly released APIs in production? Michelle, I think you've got some good news for us on that one.
Well, at this stage for client APIs, we don't have a software vendor provider that is utilising in production. However, there are vendors that are currently progressing through the build and test phases with conformance, because we just released them end of June. We encourage any vendors that are interested in these APIs to visit the developer portal for more information.
I think we do have someone using the quality indicator one in production though. Is that right, Michelle? I'm putting you on the spot.
Right.
Yeah, we do have that one. Client APIs, people are definitely starting to develop against them. And if you're a, aged care provider, I would definitely hit up your software providers and let them know to start integrating to them. Because it is a way on how you can reduce your administrative overhead. So rather than, putting all the data in your own systems and then duplicating it in our portal, you can absolutely, if your software vendor has integrated into these APIs, press a button and kind of talk both ways in getting some client information and reporting your quality indicators. So hit them up. I'm sure I'm going to get a lot of calls from software providers now going, what are you doing? But anyway.
That's all right. That's what we want. And just as a bit of a teaser, we are hoping to bring to a future Tech Talk a case study of a provider who is working with a software vendor who is using APIs, and I don't want to oversell it, but it seems life-changing from what I've seen in the early advertising. So really looking forward to bringing that to you guys at a future Tech Talk. Okay, we are really tight on time, but I did just want to sneak in a question for John, if I could. John, first of all, thank you for joining us from the TGA. It was really great to hear about the TGA's remit, but also how you're using AI in your space. There's a question from Jane. Where can providers find out whether a digital scribe is a medical device that has been approved by the TGA?
Yeah, I did post in the chat there that we do have a list on our website of all AI-enabled medical devices that we've approved. The proviso there is that there are no scribes on that list yet. So I just don't want you to go there looking for one. But also I want to also explain that it would only ever be on that list if it is indeed doing those extra things. A straight up digital scribe is not a medical device, and we will never be publishing a list of those because they're not regulated by us.
Great. All right, excellent. I think we have run out of time for any additional questions. We will try and pick those up in a future session. A big thank you to John, to Kai, Michelle. Thank you so much for joining us and also for being generous with your time on the panel. I will just get the team to bring the deck back up if I can, just so we've got that information as we log out. And team, just in regard to the site John was talking about on the TGA site, we'll just be sure and include that in the post event email as well. Okay, so that's us for today. Our next webinar will be on the 9th of September. That's my mum and dad's anniversary. There you go. Just a note going forward, our Tech Talks will be 1 hour in the future instead of 90 minutes when we were all hard at work trying to absorb all the information that was happening around NACA and all that change. We had a 90-minute Tech Talk, but going forward, we'll be pulling them back to 60 minutes. That gives everyone some valuable time back in their diaries, hopefully, while still allowing us to get you some really targeted and tailored segments. Registrations for the 9th of September are open now, so get in early. You can register using the QR code on screen or the link in the chat. Thank you, everyone. I hope you gained something from today's session, and I'll hand over to Faye to take us out for the day.
Thank you very much, Janine, and it's great that you see these forums as a valuable resource, everyone, and to find out what's happening in our digital transformation arena as we start to broaden the scope beyond a little bit from aged care as you've requested. Thank you very much, and we'll see you next time.